Good evening to all of you. I'd like to thank AOS for giving me an opportunity to present this challenging case. Presenting a case of a 29-year female presented on 6th April 2021 with a history of floaters in the left eye since one day. Patient is 8 months pregnant. She gave history of thyroid disorder on medication. There is hypothyroid on eltroxin. She gave history of skin itching, no other systemic diseases. Anterior segment examination was normal. Best corrected visual acuity of 6 parts in both eyes with normal intraocular pressure. Right eye fundus examination was myopic fundus. The left eye patient had vitritis 1+, vitreous cells 1+, pre-retinal, subhyaloid, subretinal, and intraretinal hemorrhages with whitish lesion inferior to the hemorrhage was seen in the left eye. OCT showed posterior vitreous hyperreflective echoes with pre-retinal hemorrhage with aftershadowing. On investigation, patient had leukocytosis with a WBC count of 14,900 cells per cubic millimeter with elevated ESR. Rest of the investigations were within normal limits. Peripheral smear patient had anemia with neutrophilic leukocytosis. The bleeding profile was normal. Evaluated for COVID infection, that was negative. We made the professional diagnosis of posterior uveitis with vitreous hemorrhage and subhyaloid hemorrhage with intraretinal hemorrhage. In view of leukocytosis, patient was empirically treated with systemic antibiotic after clearance from the gynecologist. Tablet augmentin was given in view of leukocytosis, and we did note this improvement and gradual reduction in the vitreous A's and also the retinal hemorrhages. This is then follow-up on 20th May. We could see the resolving pre-retinal and intraretinal hemorrhages in this case, and patient continued with a conservative line of management. She delivered. At the time of hospitalization, she had history of fever and also history of urinary tract infection. So on ocular finding, when she presented on 13/7/21, she had hypopyon. That was a mobile hypopyon in the left eye. Fundus examination, she has resolving retinal hemorrhages in the left eye. In view of hypopyon, we did the investigation. This time, they had bacteria was present with increased pus cells. AC-TAP negative for the microorganisms, and urine showed pus cells, which culture showed E. coli growth. So in view of hypopyon with the presentation, this time we did suspect endogenous end of a picture secondary to UTI after delivery. Based on the antibiotic sensitivity, she was put on tablet nitrofurantoin, systemic antibiotic, topical antibiotics, steroids, and cycloplegics were continued, and even intravitreal vancomycin and amikacin injection, depending upon the culture sensitivity report for this patient. And follow-up, this is the thing where we can see the exacerbation of retinal hemorrhages with increasing in the vitreous haze in the left eye. She delivered, so she underwent fluorescence angiography, which showed block fluorescence corresponding to the retinal hemorrhages with focal areas of hyperfluorescence suggestive of neovascularization elsewhere, NVE. And because of this, we did scatter laser photocoagulation for this patient. On evaluation, this time SARS-CoV-2 IgG IgM positive. On coming to the inflammatory profile, D-dimer was increased. That is 1,357 was the unit. Whereas other inflammatory parameters were within normal limits. Repeat urine culture after 1 week came negative. A raised value of D-dimer with worsening of hemorrhages. After physician clearance, we have started the patient on tablet ecosprin 75 milligram per day. Gradually, the hemorrhages were resolved. She had a focal fibrous proliferation and she underwent a laser photocoagulation. And now patient is doing well. She took the ecosprin for 3 months and subsequently she was stopped. Now patient is only on periodic follow-up and she's doing well. This is a sequence of events. The patient presented with retinal hemorrhages. Then she had urinary tract infections and COVID infection. There was an exacerbation of symptoms. She responded well to topical, intravitreal, and systemic antibiotics. And finally, this is a resolution of a fundus picture. Coming to the discussion, this particular patient presented with neovascularization in the retina, the vitreous hemorrhage, and during the course, she developed hypopyon. So she was pregnant and COVID antibodies was positive after that. So these are the differential diagnoses for thought. One, pregnancy-related uveitis. Second, COVID. Along with that, the patient developed history of UTI and infections with E. coli was considered. In view of mobile hypopnea and Behçet's disease was also considered, however, if a fundus fluorescence angiography was normal, no systemic features, and SLE-B5 typing was negative. Recently, we published a paper, Systemic Markers in Ophthalmic Manifestations of Post-COVID-19 Disease. In that, we quoted that serum D-dimer and ferritin levels were elevated significantly higher in patients with eye-threatening ocular manifestations. We would like to ask, we did suspect COVID at the time of presentation, but we did the RT-PCR and the antibody at the same time, so it came negative. Subsequently, it came positive. So what is the probable etiology in this case? The role of COVID-19 and UTI in pregnancy aggravated the disease course. I would like to ask the panelist opinion, would have done anything different in the management of this patient? I would like to acknowledge team members for co-managing this patient. Thank you for your attention.
Yeah, so do we have any comments?